At Stony Brook Hospital on Long Island, Steve Koloff is a patient of Dr. Max Fink. Since late adolescence, he has been the subject of contradictory psychiatric diagnoses and the victim of many years of unsuccessful treatment. He's about to undergo the controversial procedure of electric convulsive therapy, or ECT.
How you doing?
Hello.
Okay.
I'm just going to use some alcohol first.
Even its most enthusiastic sponsors concede that the administration of an electric shock through the skull is a comparatively crude assault on the underlying brain. And in the early days, when it was administered without anesthetics and without muscle relaxants to limit the convulsions that result from the shock, it was widely regarded as a punitive ordeal. And this perhaps is one of the reasons why the treatment still has a somewhat dubious reputation.
Schizophrenia, for which it is par excellence the best, and that is catatonia.
Yeah.
So the question is, does he have catatonia, the disease, and is that schizophrenia? And
even now, when it's administered with all the safeguards that normally accompany surgery, there are many hospitals that forbid its use. Although the convulsion has been limited to a barely detectable tremor in the foot, and the electric shock is comparatively mild, the brain has undergone a major upheaval. And as yet, there's no real explanation for its frequently helpful results.
See that flat?
Yeah.
Seizure's over.
In recent years, this treatment has been used most effectively in cases of severe depressive illness. But even then, it's only used very sparingly and usually as a last resort. Dr. Fink, however, has a much more optimistic view and employs it for conditions which in other hospitals might have been treated by drugs alone.
One of the consequences of a seizure is that the brain produces all sorts of chemicals in large amount, and all the cells get bathed with these chemicals which are expressed during the seizure, particularly if you repeat seizures one after another, as we do. No patient benefits from one seizure. Years ago, we would treat 6, 8 treatments and stop. And the relapse rate was horrendous, up to 80% within 1 year in some studies. That means that we stimulated the brain to do something, but we didn't sustain it. The last few years, we've gone back to an old technique of maintenance treatment. And we try to keep the patient in treatment for 3, 4, 6 months. We're not sure that that's going to be the final answer, but it surely is an interim answer, because we now have a number of patients here and in other hospitals, mostly academic hospitals, where this is being done, and the patients do well by continually being stimulated to produce an unknown substance.